Hello and what's up, beautiful people? It is your tooth doctor, Maureen Mora here. If it is your first time coming across this channel, feel most welcome. You are in the oral health squad where we talk matters oral health simply because I believe everybody is entitled to good oral health status. And guys, in today's video, I want us to talk about a commonly handled procedure in most of the dental clinics, and that is root canal. So, assuming you visited a dental clinic and your dentist or your endodontist has advised that you will need a root canal treatment. And now you are there with 100 questions running through your mind. What does this procedure entail? So basically today, I'm going to be answering some of those commonly asked questions such that to enable you whenever your dentist is talking about this procedure, you can easily relate with and know what it entails. So on to our question number 1. So I will answer what is a root canal by briefly taking you through the tooth structure. So on the tooth, we have the enamel, which is the outer part of the tooth. We have the dentine. So inside the tooth, beneath, under the enamel and the dentine, we have a soft tissue structure, which is called the pulp. This pulp contains the blood vessels, it contains nerves and other connective tissues. So, and this nerve runs from the crown of the tooth to the tip of the roots of the tooth. So, once the pulp is infected or exposed in one way or another, the process of treating it or getting rid of that nerve from inside the tooth is basically what we call a root canal treatment. A root canal treatment procedure, majorly it's not meant to be painful because in many circumstances it is done under anesthesia. However, in some circumstances, the patient might experience some discomfort, especially on the first 2 or 3 days after the procedure is done. And that is why in most circumstances you might find that your dentist or your endodontist will discharge you home with some antibiotic or analgesics to keep you through the procedure, but it is not meant to be painful. Only that in most cases you can, if you are feeling some discomfort, you are at liberty to let your dentist or endodontist know whatever you are feeling. There are many ways for you to know that you could be needing a root canal. However, the first red flag that you need a root canal is if you experience severe sensitivity, especially to hot foods. And in many attempts, I always advise this is an earlier sign. So if you go to your dentist earlier enough when you are experiencing especially sensitivity to hot foods, they can be able to help quickly before the tooth is more infected, which can be complicated. However, other signs to watch out includes pain, especially when you are biting or chewing food. You can find a pimple on top of the affected tooth. Another sign to watch out is that lingering sensitivity, especially to hot and cold foods. Yes, another one is a chipped or a fractured tooth extending to the pulp. Another sign can be swollen or tenderness on the gum. Also, if you are experiencing severe pain that is not going away, even with the use of analgesics. Whether or not you can be able to run your day-to-day activities after root canal, mostly after the procedure, you find that a patient is numb for the first 2 or 3 hours following the procedure. However, most patients are able to go on with their day-to-day activities, only that I will advise not to eat or chew anything because of the numbness on your side. You might end up chewing or hurting your gums. So it is good to have your meals after the numbness has gone down. So for the process of a root canal, here you find that your dentist or an endodontist, after doing the clinical examinations and they have established that your tooth is in need of a root canal, the first thing they are likely to do is have an x-ray done. Once the x-ray is done, the affected tooth is ruled out, and then anesthesia is applied on that side. After getting numb, there is an opening, a small opening is made through the crown of the tooth to get into the pulp. Then there are some small instruments that are used to get rid of the pulp. Once your dentist or endodontist ensures everything is out, then the tooth is going to be sealed with some biocompatible materials with the help of a certain cement. And then they are likely to put a temporary filling on the tooth. They'll advise you to come back again for either a crown or another more permanent restorative material once the tooth has fully healed to enable the teeth to function well. However, in some circumstances, if your dentist or endodontist is not doing the root canal in one sitting, what they will do, they'll just go through the same procedure, administer some anesthesia, get the opening through the tooth, remove some of the nerves. Remember, as I had explained earlier, the pulp contains the nerves, the blood vessels, and the other connective tissues are very small microorganisms. So they might not be able to get rid of them in the first sitting. They will opt to put some medicine inside the tooth. That is depending on how your tooth is presenting. Once they put the medicine inside your tooth, a temporary filling is put. Your dentist or endodontist can give you a 1 week's break to enable the tooth to heal well. Once you come back, they will go through the other previous stage that I've already explained. Well, if you choose not to get a root canal treatment, the untreated infection inside your tooth can spread to the other parts of your tooth or even your body. And at some point, it can be life-threatening. So for instance, if you have a tooth decay on your lower jaw, remember there are a lot of structures running through that part. And if the infection goes down to your throat, it can end up blocking your airway, whose end result once your airway is blocked is death. So it is good not to ignore. There are other alternatives you can choose other than getting a root canal, but I will highly advise not to just leave the infected tooth inside your mouth. Oral hygiene at any point is very necessary. So, not unless advised otherwise by your dentist or endodontist, please brush your teeth and floss in between your teeth. Yeah, so guys, that is it for today. I hope you've got to learn something in regards to a root canal. So the next time your dentist or endodontist is going to advise you to get the procedure done, at least now I have made the work easier. You are not going to be struggling to get to understand what a root canal treatment entails. Thank you so much for staying tuned. Let us get to meet in our next video. Bye bye.